All right, so welcome to Mental Health and Fertility. And welcome Dr. Tonya Wood, who is a licensed psychologist, PhD, and a wonderful presence at Kindbody who specializes in mental health and fertility. So this is a perfect host for today. We're so excited to have her and honored to have her here. And with that, I'm going to pass it over to Dr. Wood.
Thank you. And I just want to repeat the welcome to everyone who has made the time and space for the webinar. I know, again, sort of middle of lunch, maybe early morning for some, the one or two people that are calling in from the West Coast. I myself am also located in the Los Angeles area. And so just as a way of introduction, I want to tell you first about Kindbody. You're here, so you probably had some introduction to Kindbody and who we are, but just to kind of share a little bit about our vision and mission. And it all started with the idea of trying to, revolutionize fertility care, especially because it is so stressful, and recognizing that wanting to really kind of create a more a different, a pleasant, unparalleled patient experience with innovative treatment options and great success rates, and really integrating in technology through that. And I think Kindbody 360 is a continuation extension of that, and recognizing that attending to fertility care means attending to the whole person and the whole body, mind, body, and spirit. And so that is my role here. So what we do at Kindbody related to infertility, this is just a sort of a snapshot a screen of all the different services that are available. And again, people are at different places in their paths towards their family building, and come to this place by different means and different circumstances. And Kindbody, again, we want to try to be accessible and increase access for everyone. So you can see that just in the services that we offer, and this is by no stretch all of them, but the assessments, fertility assessments, egg and embryo freezing, sperm freezing, consultations with providers and physicians, and also thinking and being accessible for LGBTQI families, as well as paying attention to male reproductive health, something that we don't often think about or give as much attention to as we should, as well. And this is just only a few. I'm going to actually mention some support groups that we have at the end of my talk today. So my role at Kindbody, part of Kindbody 360, is on the mental health piece that was just mentioned. But again, it's Kindbody 360. So again, the idea is that we wrap around everyone. So in addition to some of the medical fertility services, we also offer counseling and support services, mental health counseling and support. We have an in-house third-party program called Kind EOS, where to do for donors and surrogacy and eggs, where we can do do egg retrievals and storage. And again, it really does create kind of a holistic in-house planning and programming for our Kindbody patients. There's also nutrition and mental health and all kinds of wellness specialized specifically in improving outcomes and optimizing reproductive health. And again, mental health services, really looking at not only at the specifics of going through third party or reproductive treatments, but what also happens during disappointments in this phase. So offering support, looking at recurrent pregnancy loss and pregnancy and postpartum and infertility. And that leads us to the talk today. It's somewhat in honor of Mental Health Awareness Month, which May is Mental Health Awareness Month. And what we want to cover in the time together this morning / afternoon is just kind of reviewing the facts. For me, it's always important to normalize the conversation about mental health in general, but especially when it comes to mental health and infertility and pregnancy loss as well. So just kind of reviewing some of the facts of the impact of infertility on mental health and mental health outcomes for individuals and couples. Thinking about then also the key stressors and times and points that maybe people are more vulnerable to experience challenges or strains in their mental well-being. And then just some concrete, tangible tips to kind of get through, and then what we can do here at Kindbody to help as well. So sort of starting with the facts, and I think it really is important to give context to this. Infertility is stressful. And if you're here today, you probably already know that, have experienced it yourself. but the inability to plan or create a family as desired. And I think that's a key piece in the timing that you want, in the manner that you want, with partner that you want. And pregnancy loss are among some of the most stressful life events that one can encounter. And some of the research has shown that women in particular, men have their levels as well, but for women, it's a little bit more elevated. That for women dealing with infertility, our levels of anxiety and depression are the same as women diagnosed with cancer or heart disease or HIV. So similar to any other medical diagnosis. And we sometimes forget this is a medical diagnosis that we're navigating, and that the levels of stress, anxiety, and depression are as high um, in infertility as it is for some of these other medical diagnoses. And it's estimated that probably about 90% of those that struggle with infertility experience at some point depression, significant depression. And I think part of this is because in our society, we don't, especially in Western society, I want to be clear, we don't have the best established practices or routines or rituals to help individuals and couples sort of mourn or process or adjust to early pregnancy loss and infertility. And so it becomes this sort of silent suffering that individuals have, and others, family members and friends who are really well-meaning, don't know how to respond to it. And in that sort of silent suffering, men and women, we're left feeling very inadequate, shameful, guilty, and it becomes a bit of a psychological burden. And psychological stress and psychological burden is one of the leading reasons for people discontinuing their fertility treatment. And again, it only highlights why it's so important to provide that mental health support along the way, because oftentimes we look to ourselves and say, like, what am I doing wrong? Why am I, so upset about this? Not realizing that the experiences, the emotional experience, psychological experience is very common and understandable in the context of the infertility struggles. So it's really important as part of the sort of coping and navigating this is to build a support system for yourself. That includes friends, family member, peers, professionals, and community members. And it does have to be the right combination of support. And I say that, and you hear me saying we a lot. One thing I did not do in my introduction is that, part of what led me to specialize in infertility and reproductive health as a psychologist was my own journey and path with infertility. And at that time, as I was going through it, I was looking for a counselor and mental health professional and was just astonished at the lack of availability of not of mental health alone, but of individuals who were well versed and understood emotionally, psychologically, even medically, what was going on. I spent more of my own therapy sessions explaining the terminology and the acronyms than getting support. So when I was on the other side of my own journey, I wanted to be available as a support system to someone. So we're going to talk more about building your village, but I want to talk about, like, it's also important, like, who those people are and giving ourselves permission to select who exactly is in your village. And why that is so important is because you are not alone. In addition to the mental health, maybe not just in addition to, maybe as a byproduct of or a contributing factor to the mental health challenges and struggles that we feel during infertility, is the isolation that can come along with it too. Feeling alone, not knowing who to talk to, not having anyone else who's gone through it, or at least who've talked about going through it. So navigating fertility can make someone feel very lonely, and it's really important to remember you are not alone. And that's, I start off by saying, normalizing the conversation around this is a really huge, important step, and moving out of that silence and creating an environment where men and women couples can feel supported. In fact, infertility is probably much more common than you think. The statistics used to be 1 out of 8, but I think it was in 2023, the World Health Organization actually updated that number to say 1 out of 6. 1 out of 6 people worldwide experience infertility. And so this is much more common than you think. And for women of color, sometimes these numbers are even higher. Particularly African American women are twice as likely to experience infertility, yet half as likely to reach out for support. And as I said during when I was introducing the agenda, it's not just that the diagnosis infertility, the emotional pieces of the challenges and disappointments that's going along, but in the process, in like the stages and different timelines of trying to conceive, there are some particular stressors that we can identify and be mindful of. And I want to sort of go through what these different times are. And some of you on this call probably have already experienced this, but I want to recognize it and talk about it in terms of loss and trauma. And in my individual work with clients and in the groups that I facilitate at Kind Body, we talk about this quite a bit. That by the time you get to, say, your first day of injections, you've already had to go through a year and a half, a few months of trying to get to conceive or thinking about conceiving or planning out conceiving, and then the disappointment of that, and then a diagnosis, and or just the disappointment of not being able to conceive in the way that you would want to with the partner of your choice. And so by the time you get to the first day of injections, you've already experienced quite a bit of stress. And then there's the first day of injections can be stressful because it's like very regimented in its time and these medications and sometimes you got to mix them and they have to be stored and refrigerated. So that in and of itself adds another layer. So first day of injections, the night before retrieval, the anticipation, hoping it, there's hope. There's also fear, anxiety, worry. And there's also, just the other kind of logistical navigating, getting there and who's driving me home, and one of the groups that we lead is for single parents. And sometimes they're just like, oh my goodness, I have to think about just transportation. And that can be stressful. And then, of course, the waiting game, which happens all throughout. It's not only that 2 week wait, which I guess really is more like a 10-day wait after maybe a transfer or an IUI cycle, or even if you still attempting conceiving spontaneously, that wait is, for the test results to see if you're pregnant or not. But also it is like the waiting to start your injections, the waiting before the retrieval, the waiting in between cycles. And that always comes with its own kind of anticipation. Time can begin to feel like one of the currencies we don't have or that we have the least of. And I think just sitting in that and feeling like there's nothing I can do right now while I wait, it's extremely stressful. And then lastly, this is by no means to say this is the only or last stressor, but just the social and community content. Um, you know, May is Mental Health Awareness Month, and the week around Mother's Day is also Maternal Mental Health Awareness Week. And I don't think that's um, accidental. I think it speaks to all the different, holidays, birthdays, benchmarks in our world that remind us of that can be um, triggers for some of the emotions we feel, anniversary dates of miscarriages, but also just a reminder, social media feeds. Right now is the time where school is getting out and people are talking about summer and plans with their families, and that might be something. Halloween, I hadn't thought about it, but when you think about Halloween and all the baby pictures of people and kids in their costumes at Halloween, so there's a lot of social and community content that comes at us, either indirectly or directly, people asking questions about our personal lives and family planning timeline, and all of that is extremely, extremely stressful. So again, I just want to acknowledge and normalize the conversation around those stressful content. So some ways to then talk about it. So especially if we're being bombarded, with family and friends who are usually so well-meaning and they want to be helpful. They just can't always sometimes say the right thing. So I think some tangible tips and things to do to think about talking about infertility with friends and family. So first of all, I give everyone on this call, everyone that you talk to, permission to set boundaries. this is your story to tell. It's your story to tell when and to who and how you want to tell it. So you can decide, and with your partner, if you're doing this with a partner, what you're comfortable sharing, who you want to share it with, and what you want to keep private. Um, I remember, when I had recurrent miscarriages, and in my first pregnancy, I was super excited. So we told everybody, and then I had a miscarriage. And then it was like, oh, now I have to tell people um, I'm no longer pregnant. So the second time, I was like, I'm not telling anybody because I don't want anyone to be asking me questions. And that was also lonely. So the next time I said, you know what? I need to tell somebody. I need to tell the people that I know I'm going to want to lean on if this doesn't um, go well, because not telling anyone at all was really kind of lonely, isolating, and painful in its own way. So decide who to tell. Make choices on what's best for you, not necessarily who deserves to know. I especially like our family, we think we have to tell our parents, or we have to tell our siblings, and they may or may not be the best ones for you. So decide who to tell, and who will be best for you. And again, you can find the time when no one is rushed and when you can have a meaningful conversation. And it might be over coffee, it might be on a walk, but you can choose the time that's right for you. But most important, it is about like choosing when and how and who so that you can get support. And as part of that conversation, think about what people can do for you that will be supportive. Part of the conversation can be, okay, I'm going to tell you what we're going through right now, just so that you know. And if I need anything, I will reach out. I don't need anything right now. I will follow up with you. So you can kind of plant the seed of like, don't start from, texting me unsolicited. I will text you. I'll let you know, and say like, it might be a phone call. It might be a text. It might be grocery delivery. It might be a house cleaner, whatever it is that you need, let them know, because people are really do want to be helpful. They just need to know what to do to help you. And then in addition to family and friends, there definitely is professional support out there. I'm well on the other side of my journey, and my path started 15, 20 years ago. So I think that we've made some strides, and we've come quite a ways in the mental health field. So there now are many mental health professionals who are available to provide guidance and support, who are well trained and much more well versed in this area. So sometimes getting a sense of well being in balance is maybe someone outside friends and family. And so again, at Kind Body, we do offer a team of licensed therapists to guide you. And we're available for individual counseling, couples counseling, as well as to do consultations and evaluations for third party reproduction and the support groups that I mentioned. I myself facilitate support groups on the first, second, third, and fourth Tuesdays of every month. And they have different themes. The first and third Tuesdays is our general infertility, just kind of anything that anyone may be going through. The second Tuesday is our single parents and egg freezing support group. And the fourth Tuesday is what we call our sister circle, recognizing that for women of color, we may have some unique specific issues and challenges to discuss. And even though I will say, although we have different sort of designations for the different 4 weeks of the month, all groups are welcoming and all are supportive. Our stories may be different, the path toward parenthood may be different, but the emotion is very similar. And we've had partners in the single parent group. We've had non-BIPOC people in our sister circle, and everyone always is welcome and encouraged and receive what they need from those. There also is a LGBTQI support group that Dr. Lindsay Buckman facilitates as well. So again, we want to be as inclusive and supportive for everyone in this journey. And then just again, so Kind Body 360, in addition to the mental health services and support that we provide, We really want to just kind of, again, underscore that we are here to navigate the stress of the fertility treatments and during those different time periods that I mentioned, that maybe we're even more vulnerable or susceptible to stress, grieving after a miscarriage or failed transfer, any of the social and emotional challenges that come along with it. And again, any other issues that come up. Sometimes the stressors that we experience in navigating infertility relates to something else that has always kind of been there lingering, and it opens up the door for those conversations as well. And so we are definitely here at Kindbody 360 to provide this sort of support to you along the way. So if you are looking for support, you can coordinate or schedule a one-on-one consultation with a fertility specialist. And as part of that would include a discussion of your medical history and your family planning goals. And you would work with your, I think it's a care coordinator, a navigator, who would help develop a personalized plan for you and next steps based on the consultation and the information received. And so even getting started, you are not alone. Just kind of reach out for that consultation, even if you're not sure that you want to start this process yet. The consultation, because part of it is the timeline as well, and thinking about when that might be, and estimating a good idea of how much it might cost, how much time things might take, and just getting that information. So even if you're on the fence and not sure, a consultation can begin to provide support and guidance on decision making. So to get started, visit kindbody.com to schedule that consultation. And we're here for you. Check with your employer to see if they have employer benefits that would cover Kindbody. And if you're unsure, you can visit kindbody.com /activate. And even if your employer does not cover Kindbody services, check with your insurance to see exactly what they would cover, so that doesn't further delay your journey any longer.
All
Now,
right, thank you. Thank you,
yeah,
Dr. Wood.
of course.
This was so amazing, and we have tons of questions. We'll try to get to as many as we can in the next 10 or so minutes. Let me start with the first one. So, Dr. Wood, this is a great question, and we get it a lot also in evaluating how to pick a great fertility doctor as well. But this person is asking, do you have any advice for screening therapists for discussing infertility specifically?
That is a great question. I would say I would ask their own knowledge and experience with dealing with fertility or infertility, um, and the scope of that. Meaning, like, how many years have they worked in this? Any specialized training? The American Society for Reproductive Medicine, ASRM, is provides actually sort of training modules for mental health professionals. And so someone should be familiar with in the American Society for Reproductive Medicine, ASRM, mental health professional guidelines regarding counseling for infertility. And so I think asking them the amount of experience they have, training specifically in this topic, and also ask them their approach. Any provider should offer you a 10 or 15-minute phone call just to talk to them and say, like, is this a good fit? Do I vibe well with this person? And I think that would be a good way to fill out, are they a good fit for you as well?
Yeah, that's great advice. Thank you. Okay, another amazing question. This idea of stress and the idea that stress can contribute actually to infertility, which is infuriating. Um, how advice to manage the stress without repressing your emotions. And this person's saying, I always hear that stress makes it harder to get pregnant, which isn't helpful when I'm already stressed. So please, Dr. Wood, debunk this for us.
Oh my goodness. Yes, I will do my best in like a short amount of time. It is, yes, all the things. And because all pieces of it are true. Like, this is stressful. Relieving stress might help, but that's not helpful when I'm already stressed. And so in my practice, I may give too many names and acronyms, but I want to give a complete comprehensive answer. My therapeutic approach is something called acceptance and commitment therapy. And the acceptance part sometimes is a bit of a misnomer. Honestly, the acceptance part is about recognizing and acknowledging without judgment that we are going to have an emotional, psychological experience to challenges in our life. So part of that is acknowledging, like, yes, this is stressful, because even in the way the question is phrased, which I get because I got that too. I was told so many times, just relax. Is what's infuriating about that is it dismisses the stress. And so the first thing I work with my clients is like, let's not beat up on yourself for being stressed. Let's like acknowledge this is stressful. And because we can tell ourselves not to be stressed, get distracted by that, then beat up on ourselves for being stressed. And now we're caught up in this cycle as opposed to doing the things that bring us closer to facilitating anything that can lead to a more successful outcome in the infertility. So it's like acknowledging that it is stressful, and then saying like, and because of that, I need to put some things in place to navigate it. So my work, the acceptance part is like acknowledging this is stressful. And when I'm stressed, I may be a little short tempered. I may be a little snipey. I may be a little grumpy. And that's not to kind of excuse it, but just to acknowledge it without criticism or judgment of ourselves. And then the commitment part is saying, I don't like being grumpy, but when I am, what do I need to do? Do I need to go for a 15-minute walk? Do I need to have a tea? Do I need to just like close my eyes for 5 minutes? Do I need to scream into a pillow? And build in the strategies that say, I do need to do things to navigate the stress because this is stressful. So it's a both and thing. It's like, yes, I am stressful. And relieving the stress is not about denying the stress. Relieving the stress is saying, like, yeah, it makes sense I'm stressed. So let me do something to navigate and reduce the stress. Hopefully that's helpful.
That's extremely helpful. Thank you. This is a question we get asked all the time. It's something that those who already struggle with mental health issues have concerns about when they start treatment. What do we know or not know about the effects the hormones have themselves on mental health, anxiety, depression, etc.?
Another great question. And I am not a medical doctor or physician, so I can't speak with complete authority about the interaction of hormones on our mental health, but we do know that it is there. And in fact, I'm in addition to working with Kind Body, I'm on faculty at Pepperdine University, and one of my dissertation students is looking at the role of hormones around the menstrual cycle and mimicking symptoms of depression and anxiety. So even without the additional hormones that we're, ingesting for fertility purposes, we already know that there is a relationship there. And again, I think my response would be similar to the response I give about managing stress. That yeah, we do know that there's gonna be probably, and it affects everyone differently. So it's not, consistent in how it will impact and who it will impact, because we all have to, and even within different cycles. I've worked with clients who's like, my first cycle was fine, I had no problems, and then the second cycle, my emotions were all over the place. So I think it is just being gentle and kind and compassionate with ourselves and saying, okay, there's a possibility I may experience a different set of emotions, a roller coaster of emotions while I'm doing my hormone treatments. And if I begin to notice that, acknowledging this makes sense because of this, and what strategies can I put in place to navigate the emotions? But I think that was part of the question. But we do know, and again, we don't have, like I said, even just in our natural biological cycle, we see evidence of this.
Thank you. Yeah, that's really helpful. Somebody's asking, how do we access the support groups? And I can tell you, you can access them. We'll send you an email tomorrow with a link. And then who leads them, Dr. Wood?
I do. Well, myself and Dr. Lindsay Buckman, and I know Dr. Buckman very well. I'll put in a plug. She's actually a graduate of our Pepperdine program.
Oh, wow. That's amazing.
So I know she's extremely well trained. And yes, so Dr. Buckman leads the LGBTQI support group, and I facilitate the others.
Wonderful. Okay, just one more question that I have here. Can you talk about, I know we talked a little bit about how to handle people's unwarranted, unrequested comments and questions. Can you talk about how to respond to somebody who says something like, "Oh, you just have to stop thinking about it," or "You just have to relax. The second you stop thinking about it, it'll happen. You just have to calm down." What would you say, first of all, to that person? And what would you, how can you debunk that?
Oh my goodness. I laughed a little bit. I use a lot of sarcasm, but that's me. So I know sarcasm is not for everyone. It, my response to those have always been, yeah, yeah. Like if it was funny I hadn't thought of that. Funny I hadn't thought of it. If I just stopped thinking about it, it would just happen. Um, because of course we are trying to not think about it. Um, I think a response one I'm gonna say one that is authentic and real and sincere for you, first of all. Like I use a lot of sarcasm, but I know that that is not for everyone, but one that is real and authentic for you. And I think the debunking part, right? That yeah, I wish it was that easy, but infertility is a medical diagnosis. Would you ask someone who had a diagnosis of cancer to just not think about it and it would happen? Um, if that feels right for you to say something like that. Because that's kind of what they're asking you to do. They're kind of asking you to forget that, that you're dealing with a medical issue. Because I think part of it is this idea that it's quote unquote all in our heads, which is just not true and so unfair to all of us. Because we've already done enough of a sort of challenge in our own heads of what we did wrong. Why did I wait so long? I should have started sooner. I didn't know this. And so we've already dealt with that. So, but to get back to your question of how to respond um, in a way that is true, authentic, and sincere for you. Um, and I think in one that says, yeah, I wish it was as easy as that, but it is a complicated diagnosis that involves emotions, medical doctors and medical interventions, and it's really hard to navigate when people tell me not to think about it. Like um, and I know I'm going to get a big long answer, in part because it is so complicated. Um, I think just letting them know that that is just not. It's also like it's not possible. Like there's so many reminders everywhere of this, in inadvertently, and I think the things that we have to do, in addition to kind of what do you say to people and try to debunk it, is also kind of saying like, okay, I'm building a village, I'm building my support group. I may be able to go to you for something, but it won't be for this. And I think that it doesn't have to be verbalized out loud to the person, but I think it's giving yourself permission to say, thank you for the question. I now understand where you will be supportive in my life. It may not be in this area, and I will go to those who can. So I know that was a very wieldy, not specific answer. Maybe something more concrete you can do is say, I appreciate the thought. I know that you're trying to be helpful to me. Um, and maybe it's because you're scared too. And so maybe it would be helpful for you to go to um, some of the kind body resources for family and friends. I wrote a blog about how family and friends can be helpful. So it's like, maybe you should kind of check out the resources at Kind Body for family and friends, because I think they too are trying to figure out what to do and say to be helpful, and maybe turn it back on them and say, I appreciate the thought because I think you're trying to be helpful. That's not one of the most helpful thoughts because it's really hard to not think about it when I get reminders of it all the time. Um, but if you are trying to figure out how to be of help to me, hey, there are resources for family and friends out there too.
That's great. And yes, absolutely go read Dr. Wood's blog. It's very helpful. Okay, one more question before we wrap up, and I think this is a really important one. How do we deal with tension in the marriage when it comes to infertility?
Oh boy. Again, another like that could be another hour long
That could be a
webinar.
whole webinar on its own.
um and and I try to avoid like stereotypes, but it just becomes true, and the different partners navigate and deal with emotions differently, and I think that can be a way to sort of navigate the tensions. um and again, acknowledging that we both are navigating this differently and without judgment of that, against each other. And when I do this work with couples, I talk about like, so what is it that is a shared common vision or value that you have that you can come together on, um, so that the way we're handling this doesn't pull us apart, because we're already feeling probably alone and isolated enough as it is. So where on this can we join? And that might be about where we agree on, um, physical health, or it might be where we agree on like what we tell family members, or it might be what we agree on in terms of celebration of holidays around this. Um, but I do think it's important to find ways that we can come together and what we do agree on, and just recognizing, understanding that individuals will navigate and manage this differently. I will say that in the last couple of months, I've had more than usual. I have couples join the support groups. So that could potentially be a way. And I think it has been helpful when other partners have heard other people talk about their struggles with infertility. So it's not just coming from the person they're married to or their life partner, but they hear it from other people, and I think it just can land a little differently sometimes. And so the support groups are open to couples as well. So I will say that, and we have had couples. Um, and probably the last 3 months, I've had couples in the support groups. So again, I know that's not maybe a very specific answer, but just know you're not alone in that, and that it can be hard to not fall into the like you don't understand, or you're not navigating this way I am. Or does this matter as much to you as it does to me? It does, but that person is navigating it differently. And maybe even find the strength in that and say like, okay, like how are you just kind of like picking up and moving on, because I am wanting to have a little bit of that myself. Yeah, and I just read what Vanessa said, and that is so true. I think the idea of like normalizing this and like, yeah, like this is understandable why I'm sad today, why I don't want to go to that baby shower, why I do want not want to go to your sister's house for dinner. Because she said something really insensitive, and I don't really feel like going to your family's house right now. Um, is half the battle. And our partners sometimes are doing their best, and they feel like they can't show their emotions because they want to be there for us. And so sometimes it also is about getting that outside professional support for you individually and together as a couple.
Thank you so much, Dr. Wood. That was so helpful. I know we're getting a ton of action in the comments saying that they're so grateful and this was such a great session. So we really appreciate you taking the time. And again, if you do have questions that come up for Dr. Wood, you can always send us a DM on Instagram and I will get them to her and I'll get you an answer. So if that happens, feel free to do so. And then again, tomorrow you'll get an email with this recording. You'll get our link to our support groups, and any information you might need. And thank you all for coming so much. We love having these sessions. They're so helpful to us and to all of our community members. So thank you again. And thank you, Dr. Wood. And
Thank
everyone have a
you. Thank
great rest
you.
of your day. Bye,
Bye.
everyone.